Hello, I'm Dr. Rohini. Today I'm going to talk about how obesity and weight gain can affect a woman's fertility. So, whenever there is increased weight in a woman, or if she's on the obese side, what happens is there are some hormonal changes in her body. The excess fat cells they get converted to a hormone called estrogen, and there's increased levels of estrogen in our body. And there also in some amount of insulin resistance, and another hormone which is the male hormone testosterone that also increases in the woman's body. So what happens? How does it affect your fertility? So first of all, the woman will have menstrual irregularities. So you will not know when to follow, how to follow your fertile period, and how or when the egg is being released. That reduces your chances of getting pregnant. The second thing is it affects the formation of eggs. Why that happens is, like I told you, the hormone estrogen is increased in the body, and usually this goes and suppresses a very important hormone in our body called FSH, that is the follicle stimulating hormone. This hormone is very important for the follicular growth in a menstrual cycle in every month, for follicular growth and egg development and egg release. So what happens is, because of this increased estrogen, there is reduced follicular stimulating hormone, and then thereby egg is not formed in every cycle. So there is, and this situation is called anovulation. So there is menstrual irregularity, there is anovulation. What happens is, now that when women come to a fertility center for treatment, they are given these options: ovulation induction, intrauterine insemination, and in vitro fertilization, that is IVF, about which we have already spoken in our previous sessions. In all these treatments, usually we give hormone injections for egg growth and development. So when the weight is on the higher side, those women require higher dosage of injections for egg development. The days of getting hormone injection also increases, the number of injection increases. Because of this, the quality of egg can also reduce. So this is before the egg formation. Now what happens after egg formation? How does it affect? So after egg formation, when the embryo is formed, the embryo needs a good atmosphere for implantation to happen. So now the second hormone which is increased, that is testosterone. So this testosterone hormone has a negative effect on the endometrium, that is the lining of the uterus, which has to be of a certain thickness, that is it should be around 7 to 8 mm. This testosterone hormone, it has a very negative effect on the endometrium, that is the inner lining, and it thins it out. So even if the egg quality was good, and if multiple eggs are formed in that cycle, but if the lining is not good, the environment for in the uterus for baby to be received or for baby to grow will not be good. So this is how it affects after the egg release. And even if you get pregnant, increased weight can have some other negative effects. Pregnant woman, there is increased risk of abortion. Apart from the pregnancy and fertility, it can also have some long-term implications. Like again, long-term patient can have risk of diabetes and hypertension and other medical diseases. And we have also noted that women with a higher weight tend to have some more psychological problems. They tend to have more stress, more depression, and these also affect your fertility treatment and your chances of conceiving.